These cells provide neuronal physical support and help to maintain the blood-brain barrier. Astrocytes. These cells are the inner lining of ventricles. Ependymal. These cells serve as neurologic phagocytes. Microglia. These cells produce myelin. Schwann cells peripherally, oligodendroglia centrally. The only CNS/PNS supportive cells that don't arise from ectoderm. Microglia originates from mesoderm. These cells form multinucleated giant cells with HIV infection. Microglia. These are the cells that are destroyed in multiple sclerosis. Oligodendroglia. Acoustic neuroma is an example of this type of tumor and mostly involves what nerves? Schwannoma, CN7 and 8. Sensory corpuscles involved in light discriminatory touch. Meissner's. Sensory corpuscles involved in pressure, coarse touch, and vibration. Pacinian. Sensory corpuscles involved in light, crude touch. Merkel's. What are the primary hypothalamic functions? Thirst, adenohypophysis, neurohypophysis, hunger, autonomic, temperature, sexual urges. This is the major relay center for ascending sensory information. Thalamus. What sensory information travels through the lateral geniculate nucleus of the thalamus? Visual. What sensory information travels through the medial geniculate nucleus? Auditory. What sensory information travels through the ventral posterior nucleus, VPL and VPM? VPL is body sensation, VPM is a facial sensation. This structure is important in controlling voluntary movements and postural adjustments. Basal ganglia. What is the difference between the direct and indirect pathways? Direct pathway facilitates movement, indirectly inhibits movement. A stroke of this artery will affect motor control of the leg and foot. Anterior cerebral artery. Broca's and Wernicke's speech areas are supplied by this artery. Middle cerebral artery. This is the most common site of Berry aneurysm. Lesions may cause visual field defects. Anterior communicating artery. These arteries supply the internal capsule, caudate, putamen, and globus pallidus. Lateral striae. The dorsal columns ascend in this manner and decussate at what point? Ipsilaterally, decussate at the medulla. Spinothalamic tract descends in this manner and decussates at what point? Contralaterally, decussate at anterior white commissure. Lateral corticospinal tract descends in this manner and decussates at what point? Ipsilaterally from the motor cortex, decussates 8 medulla, then descends contralaterally.